This is going to be a quick training video on how to use the Starmed Intersurgical NIV hood. So the hood that we're using here comes in a box and the hood is in two separate parts. Usually for installing on a patient you would want to put the collar on first and then the hood. But for retrieving patients with COVID-19 we advise that you assemble the hood as one piece first. So you can see where the hood joins and clips, and then you just twist it into place and that locks the hood. You've got two entry points here. You want to use the red cap from your ventilator tubing to seal off one side, and then your ventilator tubing will attach to the other. In the box you also get straps that will help hold the hood on under the arms. It's always best to clip these on first before attaching to the patient. In the box you also get earplugs which you can offer to the patient beforehand. So what we say to do is get the ventilator set up for non-invasive ventilation ready to go, attach it to the hood. Now for it to be compatible, what you need to have is the connector that comes with the flow tubing, the flow sensor tubing. This attaches to your HME and will allow you to connect it to the hood. I would now start the ventilator on the settings that are appropriate for the patient, and then we will require 3 people to put the hood in place. So most patients normally have a BiPAP CPAP mask already in place. So while this ventilator is running, what I will do is have one assistant who will unstrap but hold the mask over the patient. 2 more of you will then open up the seal at the bottom of the hood to put over the patient's head, and we then do a quick exchange. So we're just going to get that attached. Right, open up the seal nice and tight, and that just slips over the patient's head, and the ventilation is already running. Now for the hood to inflate, the most important part is pulling the anti-asphyxiation device. Once you open that, the hood will inflate. You then get a anemometer to inflate the cup to provide extra seal. If you need to access the patient, you've got an access port that you can twist to get off. You are now safe to do your transfer once you've attached the arm straps, which just clip to the front, and you can tighten with the Velcro. Once the patient arrives in intensive care, you would set up the bedside G5 ventilator to match the settings on the transport monitor. All you'd need to do then is just swap the tubing over, initiate ventilation, and open up the valve again.